It started out as malaria, or at least that's what her grandparents thought. But there was another sneaky infection lurking under the surface of his skin and inside his mouth. Mulikat Okanlawon was just a 6 or 7-year-old boy when he contracted nomē, a rare gangrenous infection that eats away at the flesh and bone of his face. Compared to the others who received nomē, Mulikat was lucky. It almost always leads to survivors are left with significant facial disfigurement that requires repeated reconstructive plastic surgery to repair. This is why some global health workers are calling nomē the face of poverty. A 1,000-year-old mysterious disease. The name nomē comes from the Greek word nom, meaning to swallow, and although cases of nomē were recorded over 1000 years ago, we still don't know much about it in the 21st century. Researchers know that nomē particularly affects children aged 2 to 6 years in extremely poor areas such as Africa and Asia, but it's not clear why children are more at risk. Jeantet and Fabrice Caterin. Jeantet and Fabrice Caterin, a young girl in the courtyard of the Sokoto Noma Hospital in Nigeria. He arrived with his mother for reconstructive operations, including a skin graft taken from her chest to replace the tissue destroyed by nomē. And they know that nomē is Ly, who estimates that 90% of patients die if they don't get treatment. But we still don't know exactly what causes nomē. The medical advisor to Doctors Without Borders, who oversees the nomē operations in Nigeria, Dr. We mostly think it's bacteria. But we're not sure which ones, says Mark Sherlock. For a reason doctors don't yet understand, bacteria in the mouth begin to eat meat and bone. A pediatrician working with the Health Frontiers organization to fight nomē in Laos, Dr. That part of the body is almost dying, says Leila Srour. It's a gangrenous infection. The disease spreads through soft tissue and hard tissue and creates a hole. Then, because there's an infection, it can get into the bloodstream. That is probably how these kids die. Not only do we not know exactly what causes nomē, we also don't know how many children get it. Nomē is a biological indicator of extreme poverty, says Srour. These children are often born where their births are not recorded, and their S will not be recorded. What we do know is based on data from those who managed to reach a hospital or by searching for survivors in remote locations. The World Health Organization last made an estimate in 1998 new cases each year. There has been no update since then. The irony of nomē is that once a country can count nomē victims, developing a comprehensive way of keeping records, then the country saw further improvements in public health and child health to stop the sickness exist, says Srour. Mulikat's experience is a clear example of how a lack of essential resources can have dire consequences. No birth certificate, no birth was recorded.